I am Dr. Peters with Peters Wellness Chiropractic and Massage. This week's quick video, I'd like to discuss how chiropractic care isn't just for back pain. Typically, if you think of someone going to chiropractic, you're probably thinking of headaches, neck pain, back pain, shoulder pain. And because one of the main reasons why people go to the chiropractor is they have pain somewhere. Pain is a great motivator, right? My book, Pain is Fantastic, right? And people say, wow, who would say that? Who would say pain is fantastic? Well, pain itself is fantastic because it's a great warning system. It tells us something's wrong. But being in pain, not so fantastic, okay? So people are in pain, they come in, they give us a call, they want us to help them. What are they looking for? They're looking for, one, to get out of pain, and number two, how in the heck do I change what I'm doing to stay out of pain, right? Or for some people, maybe it was a mountain biking accident or football or soccer, they got injured. But typically, these people are going to go back and do that activity again. So what kind of things can we have them do to strengthen and condition so that they will reduce their chance of injury? Well, how does chiropractic help reduce pain? Well, we take these joints that get locked up and we simply get them moving. Okay, how easy is that, right? The key is how to identify the proper joints. And as for those of you who know me, I do 100 different tests when a patient comes in. I do those tests, I give them a score. Hey, you failed, 10%, 20%, 30%, 40%, 50% of the tests. That tells me where this person is in their health compared to someone who, someone fails 60% and someone fails 10%. They're two very different patients who may need very different types of care, amounts of care. So looking at them and seeing what does this person actually need, right? How did the injury happen? What happened? What brought them in? Is it a dietary problem where they're eating garbage all the time and they can't figure out why their digestive system isn't working? Or do they have throbbing, pounding headaches and they're wearing some nasty perfume to work every day? Or they're not sleeping well, they're in a bad position, or they're stressed out. Really looking to see what is going on with this individual in front of me and how do we structurally take pressure off the nervous system. And if you think of, the nervous system controls everything. If you sever the spinal cord here, unless you have some type of external thing helping, keeping you alive, your heart's not going to work anymore. Your digestive system won't work anymore. And just think about the reproductive system. The nervous system is a sensitive system. And if it has interference, it can cause certain things not to work well, including, like I said, your digestive system. You ever get nervous? Like some people, they get nervous, they want to eat. Other people that get nervous, they don't want to eat anything. So if someone's going through a lot of stress, we have stress eaters, and then people stay away from the food. So really looking at, people, let's say with high blood pressure, the nervous system controls the blood pressure. So taking pressure away from that could help with the blood pressure. So just looking at what we can do to help reduce people's pain and then giving them the knowledge. If you look at on my YouTube, I believe, I looked it up earlier. I have over 200 videos on my YouTube page, and I think I only have 168 followers, which I'd like to get that up there. So I'm looking to give the content that people are looking for. Do you know somebody who has headaches? Oh, absolutely, you know somebody who has headaches. If you asked around, you would know. They could benefit from chiropractic care. Do you know somebody who gets stomach digestive issues? They get all worked up after a meal. They don't feel good. They're taking antacids and different things like that. Chiropractic care could help. Why? Because we're taking pressure away from the nervous system and allowing that energy to flow through your body the way it's supposed to. And in my office, I'm going to adjust you from the ground up. I'm going to adjust your ankles. I'm going to look at your knees. I'm going to look at your hips. I'm going to look at your wrists, your elbows, your shoulders, and we're going to look at the pelvis and spine all the way up. And we're going to do those tests. We're going to find out what isn't working well, and then we're going to clear that stuff out of there. And then within a series of visits, we will retest it and make sure that not only are you subjectively feeling better, but objectively you're testing better so that you're reducing your chance of injury and you're reducing your chance of things going awry. So remember, chiropractic's not just for back pain. It's not just for headaches. It's not just for neck pain, but it's really good at helping take care of those things. So have an amazing week. And if you hear somebody whining at work or your spouse is talking about this and that and she's not feeling good or he's not feeling good, have them give us a call. All right, we love to help. Have an amazing week.